as a new grad, everyone feels imposter syndrome, but eventually, you learn more and gain more skills, become more confident in your abilities.
That is Dr. Andrew Lee, and this is the VIN Foundation's Veterinary Pulse podcast. I'm Jordan Ben-Shia, Executive Director of the VIN Foundation. Join me and our co-host and VIN Foundation board member, Dr. Matt Holland, as we talk with veterinary colleagues about critical topics and share stories. Stories that connect us as humans, as animals, as a veterinary community. This podcast is made possible by individuals like you who donate to the VIN Foundation. Thank you. Please check the episode notes for bios, links, and information mentioned.
All right. Well, welcome, Andrew. Thanks for joining us.
Thanks for having me.
And I usually like to tell the audience how we met. And I think of all the guests we've ever had, Andrew and I go the furthest back. So we met back in 2013 at vet school orientation and then graduated together in 2017. And Andrew, can you tell us how you got to that vet school orientation?
Yeah, so I guess me and my love for veterinary medicine go way back. I grew up loving animals. Saturday mornings, I would watch Animal Planet and Discovery Channel instead of watching cartoons. So I always have that love for nature and science. Although I didn't know it fully when I was that young that I wanted to be a vet, but I always had that in the back of my mind. And then once I was old enough and begged my mom every day for a dog, got denied a lot of times, was told I was very irresponsible for wanting a dog. But eventually I nagged her enough until she gave in. And that dog, he was a miniature Schnauzer named Lucky. I was maybe like 10 when I got him. But he was just the smartest, most loyal dog. Everyone probably says that about their own dogs, but he just taught me a lot about the human-animal bond, and as far as caring for animals go. And then it was like our relationship that just really taught me and solidified my passion for becoming a veterinarian, especially as he aged. Schnauzers, they're not the healthiest of dogs. So, learned about dental care, heart disease, senior care. And that was just what really solidified me in pursuing veterinary medicine. Not to say I didn't have some deviations or other temptations along the way. When I was an undergrad, my brother was a pharmacist, and it was appealing for them to tell me to become a pharmacist. It's easy money versus veterinary school. Everyone hears how competitive it is and how difficult it can be. So originally, I going into undergrad at UIC in Chicago. I did do a pharmacy program.
Okay.
Straight. So it was like a guaranteed, you do well in undergrad, you'll get guaranteed admissions to the pharmacy program. I got a little distracted, to say in a nice way. But I wasn't focused on school. Going to undergrad, it's my first taste of freedom, first taste of alcohol. So my grades kind of faltered, and I was kicked out of that pharmacy program, which, thinking back on it, it was, terrible at the time, but looking back on it, it was probably for the best, because, potentially I could have just went to pharmacy school if I stayed that track. So picked my grades up eventually, picked my grades up after the first year. I didn't apply to vet school right away after undergrad, just because I didn't have a whole lot of veterinary experience. So I worked for the first year in an animal hospital to gain experience. Then I applied. I didn't get in then. So then I worked at an ER for 2 years before getting into vet school. And then that was where Matt and I met.
And yeah, I mean, I'm not just saying this. I've always thought of you as really smart, because when you and I would study first year, you were always the one teaching me. Like I was always a little bit behind and like trying to pick up the concepts, and you were like, oh, think about it this way. Think about it this way. So I'm glad you didn't apply right away, because then
I agree. Like, that experience was definitely invaluable, especially ER. Like you just see so many cases, and you learn technical skills, which are really important. All the doctors there at the ER, they knew I was going to vet school, and they would take the extra time to teach me things and explain things to me. So, it definitely helps going into vet school. That, I did have somewhat of a leg up over a lot of the other students.
And do you think getting lucky helped the family perception of veterinary school?
Yeah, I guess it kind of boundaries on the whole culture. There aren't very many Asians in veterinary medicine. So it's hard to know somebody to get into the field. So, growing up, animals weren't a big part of our family. We had a dog when I was a baby. We couldn't take care of it, and we gave it away. So it's that's what we thought of dogs back then. But we had lucky. He became a much bigger part of our family. I think, we were more older, more in a stable place to have a dog at that time. And for sure, it definitely, for the whole family, not just me, it definitely taught us that dogs are part of the family, and, kind of opened their eyes that, being a veterinarian can be a respectable position. Just because in our culture, most Asian people are pressured to be human doctors or pharmacists or along those lines.
Do you think that's changing over time, or is that a pretty constant thing that you've seen?
I hope it's changing. Definitely, I've done some talks to other Asian minorities, and they do say, how do they find experience? And I just think from our perspective, if we can see more Asian vets in the community, I do think for the older generations, it can become a more respectable position.
Yeah, I mean, I would hope so. I think from what I've seen, and we've had some other guests on this podcast talk about the same thing that you're touching on with cultural differences and cultural understandings of their profession, that it, once somebody like you kind of breaks the mold and does it, then it can I don't know, I guess it can break the spell. It seems then it can kind of trickle down, and your family still loves you. It's not like you've done something horrible or unforgivable. It's just not something that most people with your background do, but that doesn't mean that you can't.
Right, exactly. Definitely, at least our family definitely paves the way. My brother, he has 2 little nephews, and I'm a veterinarian, so they look up to me because of it, and I think that's good. Otherwise, if there aren't many Asian veterinarians, then the younger people, they don't have that role model figure, and being of the same culture definitely makes a difference. It makes it more relatable for them as well.
That is so cute that your nephews look up to you for that. I've got 4 nephews, and they they ask me the same question that my colleagues ask me, are you ever going to be a real vet? But it's okay. I want to know. So other people that might look up to you, I'm thinking of pre-vets or people about to graduate. What would you tell them, or what do you know now that you wish you would have known before you graduated?
Yeah, growing up, it's not something I thought about much. My culture being a disadvantage, I just didn't look at it that way. But now that I am a vet, I'm a minority, and I started. Some people found me on Instagram as a minority and wanted me to speak to different pre-vet minority clubs. And that was, speaking to them definitely hit me. That, yeah, I guess I was, somewhat at a disadvantage and had to, overcome some hurdles to become where I am now. And, they do find it inspiring. I had somebody talk to me about, similar situation, their parents want them to be a human doctor. They're worried about, culturally how it's going to look to be a vet, just because there aren't many of us. As well as, it is a big expectation to, just go from one program to the other. So you do high school, you do undergrad, you go straight to vet school. I took 2 years in between, working as a vet assistant. I was cleaning up poop and kennels, which, I'm sure isn't something, most, as Asian parents, they like to talk about their kids and how well they're doing. It's not something that's, something to brag about, essentially.
Yeah.
But I worked through it. For other people in the same situation, I think if it's really what you want to do, you just got to work through it to get where you want to be.
So you graduated in 2017, and what did you do after school?
So first job, I worked at Banfield for a year, big corporate hospital. And then after a year, I moved to the city, where I worked at a private clinic for 2 years. And then now I'm at a different clinic in the city as well.
Yeah. And that second job in between that's I think the reason why I thought you'd be a good guest for the podcast is because you and I were just catching up, having a phone call, and you told me about all this stuff you learned in that second job that you wish you would have known beforehand, and stuff that you would hope that other vets don't experience. So yeah, what can you get into more of that? What you kind of some wisdom you gained?
Yeah, I definitely feel like, I guess with each job, I definitely learned a lot. Because we kind of go through, the first two. So the first one,
sure.
Corporate setting, it was very enticing straight out of undergrad. The salary was way better than anyone else going to offer. Also, the benefits were way better than anyone else is going to offer. So I took it for the first year. The danger with corporate practices is, how the management's going to be, what the management style is going to be, and, what they take importance of. And I definitely noticed that it was more about pet numbers. So it was just more about numbers rather than pet care, or even, doctors' state of mind. They would just ask you to work these crazy hours, see all these cases, without regard to, what kind of cases you're seeing. And it also came down to numbers. And I kind of knew it would be a short-term thing. So after a year, I moved on to a small animal privately owned practice in Chicago. And, I also, I was only there for 2 years, but I learned a lot. Definitely positives and negatives. I did get a lot of autonomy. I also had a lot of good technology to be able to definitely enhance my skills and push myself and do more. We had ultrasound, we had dental x-rays, so I can definitely sharpen my skills with those things. Surgical, we had advanced surgical stuff, so I could do more advanced surgical procedures, which, otherwise, if I was still at the previous corporate setting, I probably would have never learned.
Yeah.
And it probably wasn't until the pandemic where things start to go the other direction. Things were slow for a little bit, which was fine. But then, like most vets, things just really, really picked up. And, that's where, I definitely learned a lot and, found the job became a lot more stressful. So I think some important tips, definitely, when you, especially right now, it's, as a veterinarian, we have so many options. Clinics right now, they're all desperate to hire vets. So we definitely have to evaluate, all of our options before making any decision. But definitely, and especially for new grad vets, I do worry for them just because of the COVID and what their learning experiences was, what their externship experiences were. Mentorship for them is going to be really big. So, be explicit, just ask them, what kind of mentorship they're going to provide in the beginning. Ask them what the hours are going to be like. So what you don't want is, as a new grad, everyone feels imposter syndrome. So, you guys aren't alone. But eventually, you learn more and gain more skills, become more confident in your abilities. But, mentorship is huge. Ask them what they're going to do to, give you the time and how to mentor you. You don't want to end up in a situation where, they say they're going to mentor you and then just throw you into the fire and expect you to just, survive and, have a good, work-life balance. So that's going to be important. With my previous job, my goal with my career is for clinic ownership. So, initially I looked up to my boss for guidance and mentorship. But as time went on, there are definitely some red flags there where, I knew I wanted to run my own practice differently.
Mm-hmm.
Sure, money is important for running a business, no doubt about that. But I do think that there's a fine line. You can't just expect your associates to work as hard as you do or see all those extra cases when they're making a fraction of what you're making. And it's just unfair. And, eventually, it definitely was taking a toll. I was working through my lunches. I was staying late and, sure, we get production bonuses. But, it eventually just got to a point where it wasn't worth it to me. There were other things during the pandemic, such as how, COVID was being handled. There are just certain questionable practices where I felt weren't the safest for the staff. Just because some people in the clinic were exposed and got sick to it doesn't mean that one person is not reliable or not liable to stick to the same rules as what you expect your staff to be safe.
Yeah.
And, the election came up, which was definitely awkward. I feel like politics in general are not a good topic to talk about at work, especially when you have a diverse staff. Especially this election, there are definitely wider political views than probably previous elections. So, it's something you should definitely be a little bit more susceptible to, or cognizant of before opening your mouth, which can definitely make certain employees feel very, very uncomfortable. I think it's also important to treat all of your staff equally, whether they're male or female, and talk to them with respect always. I think that's, very important as an owner, regardless, of what you're feeling that day. Just, you're looked up to, you're supposed to be the leader, and, you just have to keep things politically correct as much as you can. Everybody's human, but there are just certain things that should never come out of your mouth.
Yeah. And I'm thinking like what you just said at the end there, treating males the same as females. Like, I think for a lot of us, that just goes without saying. Like, of course, that would be the environment at a clinic. But also we don't really know that by just from interviewing or like spending a day there, it can be hard to see something like that in such a small amount of time. I wonder, like, would you suggest, I don't even know if this is common practice, but, would you suggest that new grads talk with support staff in the clinics and have conversations outside the person that might hire them or the owner,
Yeah, for sure. I think definitely, I think you should try and ask for some private time with one of the other associates, just to kind of get an inside view of what things are like. And I think that's a really good idea. And I think even now I've heard of people where they would even kind of do relief work for like a month before, making a decision to really get a better idea about how things are run, what the management is like. And honestly, I think there's a fact, I don't know, you might know this better than I do, but most vets stay at their first job for, what is it, like 1 or 2 years?
Yeah. So, I think it's below 2 years. Yeah.
Yeah. So definitely below 2 years. So, it's not common to find the first practice right away. Especially now, be smart about your contracts. I think that's going to be really big and take a lot of pressure off of you if you find a practice that you're not fitting in well, that you're not limited by that contract. So definitely, I'm lucky we have a contract lawyer in the family to look over my contracts and read everything over, to say what's fair, what's unfair. And some of the things that they constantly bring up in every contract is that the non-compete. I think that gives a lot of people, that definitely gives a lot of people stress. If you sign a non-compete, especially in Chicago, it's, a non-compete of like 5 miles here, that's a lot. If you leave a job with a 5 mile non-compete, you have to move, versus, out in the suburbs, 5 miles, it's probably not as bad. Those things are negotiable, and I definitely encourage, vets looking for new jobs to negotiate those kind of things. A lot of contracts, they'll say 5 miles, but, just say you're not going to take it unless they bring it down to 2 miles, so that, if you find that it's not a good fit for you, you're not stuck in this clinic that, you're miserable at because of this non-compete. And you do have the options to look outside of that.
Yeah, you are lucky to have a contract lawyer in the family. We've got the model employment contract, which is, it's more of a like general starting place. And then to get into the specifics, you want to talk with like a human, but that's a good place to start.
Yeah, for sure. Yeah. And then the other thing that kept coming up in contract is like, as far as like arbitration, and this is in most standard veterinary contracts, like if you and your employer have some sort of dispute, a lot of the standard contracts say that the employee, which is the vet, will have to pay for all legal fees, which is kind of shitty. So it could be something small, and then your employer or your boss will try to sue you for something tiny, just a little blip in the contract. That's something can be negotiated as well. Typically, what I've been told was to switch it to the prevailing party shall pay. The prevailing party shall be recuperated for the legal fees, as opposed to, the little guy always having to pay for everything.
You should be, like, anybody who's listening to this, you should send Andrew a check for all the free legal advice he's giving you.
Yes, I'll send you guys my Venmo.
And something you said earlier too, like to be explicit, that I think that can go into a contract too. I mean, I don't know how explicit or how detailed you want to get in that, but I've heard like advice for new grads along the lines of, I want to be guaranteed that if, for like a certain type of surgery. So if I'm doing a GDV, that somebody will be there, like supervising me, and like just things like that. Like as a new grad, if you know there are certain things that will make you feel more comfortable in a work environment, then say in the interview, and if it's appropriate, put it in the contract.
Yeah, exactly. I think that's big. Banfield, my first job at corporate was nice because they had me shadow a doctor for 3 months before really starting to be on my own, which was nice. And I don't think that a lot of practices will do that. Maybe they'll give you a month, but it's something definitely to talk about with your potential future employer. Like, just say, hey, like, I want mentorship for X amount of time before, starting to see cases on your own.
Yeah, that's big, and especially you touched on it a couple of times, like with how favorable the market is for veterinarians versus the people hiring veterinarians. This is the best time to ask for what you want. Because they're desperate.
Yeah, this is the ideal time. A lot of clinics are very desperate for more vet staff. You hear a ton of clinics where there's just long wait lists to be seen, long wait lists for surgery. So we can definitely use that to our advantage as the little guy.
All right. So something we were talking about a bit earlier, I am curious if you have any thoughts you'd like to share about I was going to say recent surge, but really it's been for a year or more, the violence against the Asian American community.
Yes, this is something I haven't personally been involved. And I honestly feel like most of the news that I hear is like not in Chicago. So I don't hear about it as often. But definitely, I think the biggest key factor here is spreading awareness. That's the only way to, get the word out there, like, hey, this is happening. And then I think, once there's more awareness, that's the first step as far as getting change. So I think that the awareness, is still lacking. So I do try to share posts on Asian awareness. When I see them, it's just not as, I think it's just like the awareness is lacking to really make any movement.
Yeah, I think so too. I just a couple weeks ago learned about the Chinese massacre. And I remember like a year ago this time, I hadn't heard of the Tulsa massacre against the Black community there. And so and yes, those things happened a long time ago, and we're talking about the present day awareness, but just the awareness that like this really isn't a new thing, and it's been happening for a while. And so when people say like this is a big deal, we should be listening and not just thinking that they're making a mountain out of a molehill.
Right. Yeah, for sure. And I just feel like I just feel like even like the regular media attention, like I think this probably happens for, any kind of, crime against minorities. It just kind of gets washed out, and that's unfortunate.
Yeah, I agree. All right, Andrew, we are about out of time, but what would you tell your veterinary student self or your pre-vet self, knowing what you know now?
So there are going to be a lot of bumps in the road. There's going to be a lot of moments where you just kind of pause and, got to think about, are you really making the right decision? But, for me, I've definitely feel like I've overcome a lot of hurdles, and I certainly don't have any regrets in the journey that I've made. As far as telling my pre-vet self, there were a lot of moments where I had a lot of anxiety. I think if I could just go back and tell myself it was worth it, then it probably would have released a lot of stress.
All right. Well, thank you again for joining us. It was great to talk with you.
Thanks for having me, Matt.
Thank you for joining us for this episode of the Veterinary Pulse. Please check the episode notes for additional information referenced in the podcast. If you enjoyed this podcast, please follow, subscribe, and share review. We welcome feedback and hope you will tune in again. You can find out more about the VIN Foundation through our website, vinfoundation.org, and our social media channels. Thank you for being here. Be well.